Good morning, everyone. Well, that was a great intro. I thoroughly enjoyed that, and I'm really inspired now. My name is Elaine Sardison. I am the Director of Immunization with Alberta Health in the Government of Alberta, and it is a pleasure for me to be here to launch the first plenary session. This plenary session is called New Developments in Immunization Strategies, and we have three very notable speakers that I will introduce momentarily. Our hope is that you will leave this session to be able to understand the outcomes of the National Immunization Strategy Review and to describe the various components of the national, Alberta's, and Manitoba's immunization strategies. We will leave questions for the end of the session, and if we do run out of time, because our speakers are just so great and enthusiastic, there is a question box at the end, at the back of our plenary session. And what we hope to do, if there's time, to respond to some of the questions in the next 2 days. And if not, we will post the questions online and provide an answer. And I'm getting nods here, so that is the right response. Thanks, guys. Okay, so our first speaker is Dr. Martin Lavoie, who will be describing the National Immunization Strategy and the subsequent review by the task group. Dr. Lavoie is the Deputy Chief Medical Officer of Health here at Alberta Health and has responsibilities for communicable diseases, infection prevention and control, and immunization. Dr. Lavoie has gained a lot of experience in a variety of public health physician positions in Quebec and Alberta. He is a member of provincial and national committees, which include being co-chair of the National Immunization Strategy Task Group, which has been established under the Pan-Canadian Public Health Network to review the current national immunization strategy. So please join me in welcoming Dr. Lavoie.
Good morning. Show me how passionate you are about immunization. All right. Well, I'm quite happy to be here, and thank you, Elaine, for the introduction. So my job is to talk to you about a project that started a few years ago, and I had the privilege of being the provincial territorial co-chair of that task group. And so, well, first of all, I was told that I needed to tell you that I have no conflict of interest. Unfortunately, when you do have conflict of interest, I think it means you have more money, but unfortunately, I don't have any. So what I'll be doing this morning briefly is I will talk to you about, well, the current national immunization strategy, and then talk about the work that we've done over the last few years in terms of looking at the current strategy, trying to update it, refresh it, and then move forward to improve immunization programs in Canada. And so I'll be talking about the work that we've done and also where we're at, what we looked at, the types of actions that we're looking at for the future, and then also our next steps that are coming in the near future. So once upon a time, if you remember, in 2003, we had our first ever Canadian our national immunization strategy. And this came after recommendations to create one because as a collective in Canada, we have federal government and the various jurisdictions, provinces and territories, we were faced with quite a number of challenges. And challenges in terms of the cost of vaccines that were going up very quickly, the new vaccines. Security of vaccine supply was also a growing issue. Public attitude was changing and was not perfect when we think about immunization and their perception. And vaccine safety was also a key piece that we were concerned with, and also the fear of outbreaks. And so then there was a collaborative, and you'll hear that word often today, collaborative efforts to actually create a strategy so that we could focus as a collective and we can have a plan in place for all of us that we can work towards. So there's kind of it's noisy a little bit. So So what the current strategies it was actually is doing and was doing at the time was to set national goals for a number of diseases and objectives. And it talked a lot about collaboration, sharing of resources, strengthening what we're doing together. And that includes the bulk procurement program that we have, buying vaccines together. And so we can actually benefit from better prices, but also better products and have the products that we want when we want them. And also, we cooperated on a number of things over the years, and so that was one of the objectives of this strategy. So, of course, we were able to accomplish quite a number of things with the strategy in the last 10 years. And so it started in 2003, and people have noticed a number of changes. And so we have very credible vaccine guidance documents, so the NACI recommendations and statements, the CIC statements as well, and others. And so we have that, and it got strengthened. We have also better knowledge translation to support the use of evidence. And so that made also a big difference. And we really try hard to support our actions to have evidence support our actions. Also, we strengthen our core competencies in a number of different ways, be it education, information to the public, and et cetera, and along the whole spectrum of vaccine program delivery. Also, in terms of adverse events, it got strengthened and got better as well over the years. Our vaccine prices have been actually quite a success. I don't know if you know, but the prices of vaccines in Canada, the prices are actually excellent when we compare to other countries, and probably due to our bulk procurement process. So volumes speaks volumes. So also our supply is more reliable. It's not perfect, as you know. We had shortages and issues over the years, but I think it would have been worse otherwise. And so we have strengthened our vaccine supply, and also we're able to do quite a number of other things better and faster. And so that is wonderful what the current national immunization strategy has been able to do. So the current immunization strategy already had goals of reducing burden of disease in terms of vaccine preventable diseases, trying to reduce the burden on individuals mostly, and also to have the best, like timely, great vaccines, good programs, equitable programs, reaching to people, affordable vaccines, and good supply and public confidence. And so these goals, interestingly, at the time, are repeated again now, because we have challenges in the same areas. Who knew? And so I think what we realize is it's time again to look at this and go even beyond what we had in the initial national immunization strategy. So what we did is the Pan-Canadian Public Health Network created a task group to look at this specifically, review the current national immunization strategy, look at strengths, because we have tons, but also look at gaps and weaknesses, because we know these are increasing. And then from there make recommendations in terms of future immunization programs in Canada. So that's quite a lofty goal. And so that was created, and the task group was created and was composed of 10 members, experts in the field of immunization, and also 2 co-chairs. So I had the privilege of being the provincial territorial co-chair, and Dr. John Spica from the Public Health Agency was the federal co-chair. And so that was actually quite a privilege to be able to bring those people together and work on this project. It was just fantastic, I have to tell you. So the members were experts in a broad array of areas related to immunization. So we didn't need to have one person per jurisdiction. We needed to have the right set of experts to make recommendation. And obviously, I mean, I'll tell you more about what we looked at, but also we wanted to make sure that as a collective, we were able to collaborate more, work together more, share more, and maximize the use of our collective resources. So the process that was quite a process. So we were a small group, and we met many times. So we had 4 face-to-face meetings along the way over the course of about 2 years, from 2011 to 2013. And I don't know if you can you do the count there, 25 meetings by teleconference in addition to that, plus the co-chairs and the support team was there as well. We were meeting on a regular basis, and plus also we had sub-working groups to address specific issues, reporting to the task group. So that was actually a gigantic effort to look at the whole thing and make recommendations. So hopefully you'll be happy with what you hear this morning. So obviously along the way we had to reach out to the jurisdictions that were eventually impacted by this, and also other experts in the field, and we needed to contact them and get their input as well. And along the way, of course, we were providing updates to the public health network, just to make sure that we were on the right track. And in the end, so you have it here, an image of the two reports. So we have an executive report, which is 19 pages long, very succinct, very targeted, very focused. And then we have the technical report, more of all the content and the things that we considered and the reasons why we made those recommendations in the technical report, which is 100 pages long. And so that's the fruit of our labor. And talking about it this morning is a little bit like, it's kind of like my baby, and so I'm quite happy to talk to you about that, because I think this is great work and it will help all of us, frontline or otherwise, in terms of making immunization programs better in Canada. So if you were at the Canadian Immunization Conference in Vancouver in December 2012, we kind of gave a few highlights of that work, and so you'll hear some parts of it again. But now the report is actually out, and so I can talk a bit further in terms of what we were looking at and the kinds of actions we're thinking about. So here you have a list of the 10 areas that we were looking at. So I'll describe those in more details, but we did look at general things and then more specific areas, and to make sure that we were able to make very solid recommendations for improvement. So the first one is, first of all, we wanted to make sure that we were all on the same page. So we created, and sometimes you know it's vision and objectives and guiding principles, and we cannot stress how important they are, because with this we had commitment that yes, we're on the right track, yes, we believe in this, yes, we want to do this, and yes, we will do this. Now we need the details of how we're going to get there. And so we had approval that this is the right vision, we have the right objectives, and we have the right guiding principles. And so the first one was we needed endorsement, and we have that. And so, and for each of those slides I put the vision down, and we worked 2 years to get there. So I'll read those to you, because this is the key of what we're trying to do. So in this case, what we want, and I hope you agree, all Canadians enjoy protection against vaccine-preventable diseases through timely and equitable access to effective, sustainable, targeted, adequately funded, and well-coordinated immunization programs focused on minimizing health risk and reducing disease burdens as a vital element of a public health strategy. I hope you like it, because this is where we're going, and I think we need to have a strong vision, and immunization is very complex and it's filled with challenges, so the vision had to be a bit longer than just a few words, and so that's what we've landed on. So I said what we were working toward in terms of actions, endorsement of this, we have that. Committing to strengthen collaboration and cooperation, the work that we're doing is actually an example of that, and so we've agreed to that. Through various mechanisms that we have. It could be the regular federal, provincial, territorial mechanisms that we have, and others as well. And we want to strengthen those when necessary, but I'll certainly maintain those when they work well. So now the details, more of the details in terms of what exactly we were looking at. So the first one is called Vaccine Guidance and Coordinated Scheduling and Programs. It's a mouthful, but I think you'll understand very easily that when a manufacturer is actually developing a vaccine, it takes quite some time, and eventually they submit all sorts of information to the regulator, Health Canada, and at some point they get what we call a notice of compliance, and then they get approval to actually use and sell the product in Canada. So that takes time, and then well, technically in the past what we were seeing is after that then you get, at some point, you get a NACI statement that says, yes, we've assessed this vaccine, it is a good vaccine, it does a number of things, and it's effective at doing these things, and we can target these high-risk groups, for example, and it's safe. And so that's the typical NACI statement, which is extremely useful, but again, it takes a bit of time to get that after the notice of compliance. After that, usually we wait for a more programmatic analysis of how then we could implement a program if we implement a program. So looking at the cost effectiveness, are we investing a lot of dollars for just a little bit of bang, or are we investing a lot of dollars but we get tons of health benefits? So we look at these kinds of things. Ethically, how should we implement the program? Do we have the capacity to implement the program? Is the program acceptable to the providers, you guys, or the public, et cetera, et cetera, et cetera? And then we get at some point a CIC statement on that vaccine. And so again, that takes time. And then jurisdictions, provinces and territories and the federal government, we look at this and we say, okay, what do we do now? And do we implement a program? How do we implement it? Et cetera, et cetera. And again, that takes time. So between the notice of compliance and implementation of a program, it could be up to easily, well, many, many years, 7 years and even more. And so what we're trying to do is to streamline the process, make it more timely from the development to implementation of a good product. We want to make that as short as possible. When we have a good product, we want to use it, and we want to use it fast. So we're looking at streamlining the NACI CIC process with the jurisdictions, and we have a pilot project that seems quite favorable. So more work on that. Vaccine innovation and development. So we want to make sure that the vaccines that we develop and that we get access to in the future are in line with what we need in public health. Very important. And so we need to be able to connect with industry and other partners to be able to actually do that. And so we're part of the discussion early on and not later when the vaccine is actually there. And then we say, okay, what do we do with that vaccine? Try to be a bit more collaborative along the way. And so we're making some progress there as well. Programmatic research and evaluation. Sometimes you see all research, it's out there and it's not really useful to what I do. We're trying to bring this together with what we do and trying to inform our programs with good research that we need. And we have so many questions that we need answered, and we're trying to improve that. Stronger research capacity, better collaboration, and so that hopefully will help. And also we want to make sure we have enough research, well-funded, and evaluation as well, because we don't probably do enough of that. Because we implement programs, we need to also evaluate how they do and how they could be modified if necessary. Surveillance, again, we need to know about not only immunization rates, but the diseases we're trying to control, the various factors that lead to those infections, and also why people are not getting immunized, all those factors that we need in our programs. We need to have better surveillance, more integrated, and for sure we need immunization registries across Canada. Canadians move between jurisdictions, as you know, and so we need to also be able to track them and provide the best immunization programs to them, whether they live in one province or another. And so we need to strengthen that. We do a lot of that, but we need to bring it together more, and we need to strengthen it and have more of that in all the areas that I've mentioned. Outbreak and adverse event response, we need to be really, really strong there. Even though we have immunization programs, we also see still outbreaks. We had an outbreak of measles in Alberta recently. There was one in Quebec not long ago. Influenza every year, and other outbreaks as well. And we need to be able to be really strong preventing them if we can, or otherwise managing them very, very efficiently. And adverse event, same thing. Our programs, we implement a program, we immunize people. We need to be able to track adverse events very, very the best way possible, so that we can reassure people that when we have a program, the vaccine is actually safe, and that we do pick up any type of signal, and we are able to work on those if we need to. So public and professional education and engagement, that concerns you guys. So we need to be very, very good at having the right messages for the right person, educating our workforce, our immunizers, and others as well that pass on the message to the public. And also we need to have the right message to the public, for the public. And so we need to be able to do that more. We certainly can collaborate. We do not want to reinvent the wheel in each jurisdiction or in each zone or in each region. And so we're trying to look at ways to combine this, maybe some kind of a clearinghouse, more collaboration, and continue the work in that direction. Security of vaccine supply, my God, what a pain when we have a problem. So I'm sure you know when we have shortages, it is painful. I can assure you it's painful not just at your level, but at every level you can imagine. So we want to make sure that, first of all, we have good protocols in place to, well, prevent vaccine shortages to the extent possible. But also, when we have a hint of a shortage, that we can act quickly before it becomes a big problem. And if it becomes a big problem, we have plans in place that are pre-discussed, pre-approved, so that we can actually mitigate the impact of a shortage, be it measles, that would be terrible, or pentacell, or these types of vaccines, or influenza. And I think we've seen it all probably in the last 10 years. So we are trying to work really, really hard, and there's actually a task group looking at this that I'm chairing. I keep saying yes, I think, to way too many things. So we're trying to actually improve in that area as a collective, and I think we can make great progress and be much stronger. No-fault injury compensation. So what is this? So we don't have this, and I think you'll get a kick out of this. So we've heard about the G8 recently for some reason, quite a bit. It's in the news, the G8, particularly because of Russia, so maybe we're talking about the G7 now. Unfortunately, Russia and Canada are the only two countries in the G8 without a nationwide no-fault injury compensation program. So, so this is quite interesting to note. Quebec has a no-fault injury compensation program, so maybe we should applaud Quebec for that, the one member here. This is actually probably quite important to consider, and I think in our recommendation from our task group is jurisdictions need to consider implementing a no-fault injury compensation program. So I'll tell you a little bit more here because it's new. Most of us, except maybe for Nadine over there, we don't know really what this is about and why it's so important. So technically, if somebody gets hurt, quote unquote, or has an adverse event following immunization, right now the only recourse is to sue somebody and use the tort system and blame the immunizer or whoever provided the vaccine in terms of, you hurt me, now you need to pay, kind of thing. And so that doesn't work well in this case for a number of reasons. And why it doesn't work is that technically what we're trying to do is, as a collective, as a society, we're implementing a program that technically is not supposed to be hurting anybody. The vaccines are safe. And once in a while, you have those unpredictable, idiosyncratic reactions, an allergy, for example, that could be quite severe. It's rare, but it happens. Or some people react very strangely for no good reason, no known reason, but it happens. And so then you want to have a process where you don't want to punish the immunizer. You want to actually compensate the person that actually pays the price of participating in this wonderful program. And so it's kind of flipping it around, and it's a completely different perspective. And so not having one actually has a number of negative side effects, and it actually deters manufacturers to be more active in the field of immunization, and we've seen this in the States in particular. And also, well, it deters, people don't actually go through the process. It's very costly for the person, the victim. It's also costly for the company, but also us as a collective as well. And we don't want to waste our resources, and there's a better way to do this. And we can learn from Quebec and other jurisdictions who have such a program, and it works well, and the cost is actually quite small. For the country, the estimates are that it would probably cost around $4 or $5 million per year for the whole country. And you can have one lawsuit and it costs $1 million. So you could see where this could be going. And so anyway, strong recommendation, very interesting thing to look at. We're not used to it in most jurisdictions, and so we need to analyze this a little bit. But the recommendation is clear, we should have such a program. So what now? 0 minutes. So I'm sorry. So our report has been given to CIDSC, the steering committee, and it's been approved. And now we're working on various pieces more, because the recommendations are, this is what we see and how we should do it. Now the next step is more details, the action plan to go with that. And so we're taking one area at a time and moving them forward. So at the moment, there are 3 things moving forward. So we should see improvements in the next few years. So the Public Health Network is looking at this, and the Deputy Ministers of Health are looking at this and expecting more recommendations, more details in terms of how we could get better at this. And so it is our hope that immunization programs in Canada become the best that they can be, and that we can maximize the use of our scarce collective resources for the benefit of all Canadians, protecting them from vaccine-preventable conditions to the extent possible. So I hope this gave you a quick overview, but some understanding of what we're working on and how it connects to, from your level all the way up to the ministers of health. And together we can make a difference, and hopefully with this we'll be able to make quite a few steps forward. Thank you.
Thank you, Dr. Lavoie, for